everyone, welcome back to Newfound Happy Hour. I'm going to get into this episode, but I first just wanted to say that editing this back now in my third trimester, I took a bit of a break because we actually had a pretty busy pregnancy after I filmed this video. We were actually in hospital like 4 different times and had some scares, and so I will talk about that in a future episode. But in editing this one back, I'm realizing how overstimulated I was trying to film this video. It was so hot in our old house, and our dog was barking, and a huge cause of stress for me at the time was where we were living. And if something even remotely annoying or overstimulating happened, I would be just like spiraling about like how are we going to do this and like live like this with a baby. Even though I knew that we were going to our new house soon, it was still really hard for me to like not go down worst case scenario when something annoying was happening. I mentioned in this episode how I had a full on cry session in therapy during the second trimester. Um, so yeah, if you notice that, I noticed that too, and I'm happy that I'm not as much in that headspace for sure, especially after moving and everything. But I'll talk about all of that in a future episode. And I just want to say before the episode starts that I think I'm really trying to find a balance between informing people without like fear mongering or pushing like potential negative thoughts. For me, I think I need a healthy balance of knowing all the things that could happen and all the negative sides to pregnancy, and then also the positive sides, like having both. But yeah, so there's a part in this episode where I take a little cry break, which is just funny looking back on, like I'm laughing at it now, but in the moment things can feel very heavy. So just a small note before it starts that if you do feel that way at any point during pregnancy, it's so valid. And now that I'm in the third trimester, and like I said, I will do an episode on that and how everything is going now. I'm happy that things do get better, or at least they have for me. So thanks for listening, and we will get started.
Hi, everyone. Welcome back to Newfound Happy Hour. This is Sarah. And this podcast, I usually talk to guests and just talk to people about their experiences or anything that they want to share. And sometimes it's just me. So, a big thing in my life is that I'm pregnant. I did a couple episodes on this about finding out that I was pregnant. I did a first trimester recap kind of with all my tips and all the appointments that I had and all the things that I bought and just kind of documenting everything that I'm learning during this time. My most recent episode was with Emily Bland from Succeed, and she was talking about her career and dating as someone who's so career focused and what that's like, and also all of her travel experiences. So check that out if you haven't already. I also plan on having a few more guests on in the next couple episodes. But this episode, I wanted to do kind of a second trimester recap. So, all the appointments that I had in the second trimester, which is from week, I think, 14 to 28, about there. And just the lessons that I have learned and things that people have shared with me. And again, this podcast is usually trying to give big sister energy or best friend advice. And these are definitely the things I would say to my sister or best friend if they were going through this for the first time. Something I wanted to talk about first is announcing your pregnancy. I announced that I was pregnant. I mean, we told friends and family when I was about 9 weeks, once we had an ultrasound where we knew there was a heartbeat and everything. But we told like close friends and family at about 9 weeks. Some of my friends I did tell earlier just because it was the holidays and I had to tell them why I wasn't drinking. So I kind of talked about all that in the first trimester recap, but I didn't mention about announcing or like knowing when to announce. A lot of people like to wait until the 20-week ultrasound, your anatomy scan, to make sure that there's nothing wrong with the baby in that way before they share the news. We shared after we got our genetic testing results back. So we ended up getting those results and having a ultrasound when I was like exactly 12 weeks or almost 12 weeks. So that's when I felt comfortable posting. I don't think there's a right or wrong time. And I think the overall message of this episode is that every pregnancy is different. Everybody's different. everyone's preferences are different, and we need to stop grouping all pregnancies or parenting into one category. So it's really up to you. I think a lot of people tend to hide things for many different reasons, all of which are valid, but I'm kind of looking at this from the mindset of like, I'm just going to tell the truth and be honest about everything and be open about everything because I think it normalizes what a lot of pregnant people go through. And I think that's like everything from the moment you get pregnant. You're like, should I do this? Should I do that? When should I do all these things? And you kind of look to other people to see what you should do, but really everything should just be on your own terms as far as I'm concerned. And I think that summarizes all of the lessons that I've learned. Like, it is not one size fits all, and you can do a lot of things when you're pregnant that people think that you can't do. You can still go to the gym, you can still lift weights, you can still get your hair done, you can still go out to a bar. You can go on a bus crawl, which someone told me in my Instagram comments recently that you cannot or should not do. And I asked people on my social media, like, what are things that you worried about or things that people say to you that really irritate you when you're pregnant. And when you're pregnant, you're irritable and you're a little bit more ragey than normal anyway, I would say. At least I have been. And I know that a lot of people have told me that that's very normal. And so a lot of it is just learning to drown out the outside noise and sometimes your own voice in your head and just like really focusing on what is right for you and what makes sense for you. And like you can do all those things safely and you don't have to make yourself smaller because you're pregnant, which is kind of sounding funny, but yeah, like you don't have to lock yourself in your house for 10 months because you're pregnant. It's just not how I want to be, at least. And if you want to do that, that's great. But we need to be able to have the choice, and we need to tell people, or we need to not tell people that they have to have it one way or the other. And I think I said this in one of the first trimester episodes, like being pregnant really prepares you for being a parent, I think. One thing that I learned is you need to ask for what you want and you need to ask for help if you need it. And you need to tell people how best to support you because everyone is different. A lot of people just say, like, oh, you should show up for mothers. And of course, you should. But like, people can't read minds. It's the same as any relationship. Like, people can't guess what you need. And everyone is so different. Like, some people are anxious about different things than other people. And some people are like experiencing more physical symptoms and more tired and more sick. And what we all need is not a one size fits all. And a lot of the time you just can't understand until you go through it. Like, I kind of wish I had been there for my friends who are pregnant in a different way. But it's also kind of hard when you don't know yourself and like no one kind of gives you a guide on it. And a lot of people don't talk about how it is or their experiences. And I think that's changing. I think we do talk about it a lot more, and social media and things like this definitely help. But a lot of my friends are surprised at the things I'm telling them, and like I'm learning a lot, and I thought I knew most things about pregnancy, but I'm still learning a lot. And a lot of the things that I'm telling my friends, they're like, oh, I had no idea. Even some of my friends who have had kids, like, didn't know that certain things could happen to you during pregnancy. And it's kind of crazy. And I think a lot of it stems from fear or from judgment or just, yeah, like for whatever reason, not talking about it enough. Like, you don't get an OB right away. A friend of mine was surprised at that. I'm 26 weeks right now when I'm filming this, and I won't see my OB until I'm like 29 weeks. The worst physical symptoms are in the first trimester for a lot of people. I didn't know that. I remember a friend telling me she was really tired in her first trimester, and I was like, if you're tired now, you're going to be really tired later. But it actually hits you harder in the first trimester. Like, a lot of people say that postpartum fatigue is not as bad as the first trimester fatigue, which is very reassuring because I was going through hell in the first trimester. There's also no cold medicine suitable for pregnant people. I've had a cold 3 separate times since January. Your immune system is also a lot lower or a lot less, a lot weaker than it is. And the amount of things that you can take for any ailment, like any medical condition that you may have, what you can take is so limited. And like, it's not even recommended to take Advil. So I was living off of just cough drops and honey when I had a cold. And you can take Tylenol, but everything is like check with a doctor because everyone is so different. So you need to make sure that your specific pregnancy and your specific health conditions aren't going to interact in some kind of way with any drug or medication that you take. I also learned that there's not much point to see a dermatologist or an eye doctor or anything like that when you're pregnant because you can have temporary skin changes and vision changes. And I saw a dermatologist and he essentially was like, oh yeah, just come back and see me in November, a couple months after you give birth. So that was a lesson learned. And then even just small things like a lot of my skincare that has retinol in it or certain ingredients like certain sunscreens are recommended not to use when you're pregnant. And it's kind of overwhelming, all of the things that you should or should not do. And I say should or should not in quotes, but obviously there are certain things with scientific evidence that you should or should not do. But then there's the things that are just opinions that are just based on like old ways of thinking or someone's personal preference. And something else is me and a lot of my friends have learned about like aunts, moms, family members, just having miscarriages or pregnancy loss or stillbirths or things like that. And it's always been so common. It just wasn't talked about enough. That's something else that isn't talked about enough. And a big part of me doing these episodes is just to normalize a lot of the things because it is so common, but people still feel so alone in it. And everyone's experience is different, but a lot of things are still relatable. And if you don't have a large circle of women, like I have a lot of aunts, cousins, family members, I have a lot of different friend groups, so I feel like I really do have a good support system. But if you don't have a large circle or you don't have friends who work in healthcare or like anyone who can really give you support, if you don't have a family doctor, information can be harder to find and it can be harder to find people that you relate to or have been through the things that you're going through. And like I said, a lot of the lessons I learned, I think also prepare you for being a parent. Like things are so unpredictable. You really can't control like certain things that are going to happen to you health-wise. It's hard to plan for your hormones being so up and down. That was something that I really struggled with, I think, even in the second trimester of like, I usually feel so in control and calm and not very emotional or dramatic. And I have definitely had more instances of like crying, and sometimes it's warranted and sometimes it's not. But just the roller coaster of that and like not feeling in control was a big lesson. And I feel like that's going to happen often. Like I'm going to be overstimulated more often than I ever have been, probably, or at least the potential is there. So like learning these things during pregnancy, I think is preparing me to have a baby, which is good. Also learning the importance of having a good partner. I would not be able to do this without a supportive partner. I wouldn't have done it. The only reason that I chose to do it was because like I knew that all the negative things about being a mom wouldn't be as much of a factor to me because of my good partner. I'm also learning the benefits of therapy. I've been doing that. That has been very helpful. I just sobbed in a therapy session recently, and I think that that is a really good tool. I'm happy that I now have that established so that if anything does happen postpartum, that I have that support already set up. And something else too, people always say that fed is best when they're talking about a baby, but I have learned that fed is best when it comes to the mother as well. I had a lot of like, not guilt, but just frustration that I had so many aversions in the first trimester and in the second trimester, like just struggling to eat healthier and not give in to cravings. And I think I've done a pretty good job. Like I have mostly just craved like fruit and smoothies and yogurt and things like that. But overall, like you worry about everything that you're eating, and overall it is better to just be fed. So even if you're eating anything, like your baby will take the nutrients from your body that it needs. And that's something else that I learned is that I'm low iron. So even if you're taking supplements, your baby will still suck like every bit of iron that they can out of you. I'm actually waiting to get a transfusion. But anyway, those are all things that like you just can't plan for, and I'm trying to just soak up as much information as I can and learn as much as I can and make my own opinions and choices for myself. And even if you're confident in your decisions, you still feel this like guilt and anxiety around it. And I guess it's all biological for the most part, but really talking to people who I trust and respect and all of that has been a help. So I'm just going to do a rapid fire of all the random fun fact things that I learned or just random symptoms. I don't know if I mentioned this in the first part, but I used to have sciatica on and off throughout university and then in my 20s. And normally I would get a massage and go to hot yoga. I usually did that regularly and it would go away. But it kind of came back at the end of the first trimester. Something else is that this dog has been extra protective of me, as annoying as he can be. So, anyway, it kind of got worse in the second trimester, and anytime I was standing up straight or anytime I was like lying in a certain position or just standing up for a long time, my left thigh would go numb the same way that it used to. And that was just really frustrating because it would be like I would try and take time to myself and just like go to the mall or go grab a coffee or something, and standing up in a lineup, like I would just get so anxious and uncomfortable about that feeling. I also have always gotten migraines. I had some early on in pregnancy, but not too much. I've kind of just always had them here and there throughout, like, I guess my late teens and 20s. And anytime I'm like numb or like tingly, it like I have PTSD from my migraines, I think. So yeah, anytime that happened, that was just really annoying and really frustrating. There are a few things that I found that help with that. So I'm going to talk about all of my appointments. It might be a part two or later in this episode. I also wasn't expecting pelvic pain or just like muscle pain as soon as I had it. And I learned that muscle separation can actually happen early. Hasn't happened to me yet, but just like the pelvic, I guess, heaviness and like pressure. I am doing prenatal yoga and I have seen a pelvic floor therapist. So I have all that set up to kind of deal with that. I'll also talk about that when I'm talking about my different appointments. Something that happened early in the second trimester was my taste was still very, like I didn't have aversions as much as I had before, but there were a few things I ate where I could taste mold, and I know that they were washed thoroughly and like it was fine, and Bruce kind of had a taste of them and he was like, this is fine, but I could just only taste mold. It was crazy. And it's pretty cool because it's just your body's way of like protecting you and making sure that you don't eat things that you're not supposed to eat. But it was kind of annoying. Something that I'm like dealing with at this very moment, because I think I'm getting warm because it's like sunny out for the first time in forever, is congestion. I have been congested since January, like most mornings, and it doesn't go away. It just like gets worse at different points of the day. And then when I've had a cold, like that on top of the sickness has just been terrible. And I'm literally dealing with that right now, like for no reason. I also didn't know that you're more susceptible to yeast infections because your pH changes. I won't get too much into that, but that is something that is very real in the second trimester. I didn't know that movement could be felt as early as it could be. For me, it was around 15 weeks, and then I could definitely feel more, like more and more each week, but definitely in week 22 to 24, I was feeling like very distinct kicks, and you could see them from the outside and everything. And like now you can definitely see them and feel them from the outside. And something with the pelvic pain too that I didn't realize is to be able to like stretch your muscles release relaxin, which helps your muscles stretch without it being painful. Even though it is still like tender and sore and whatnot, like it's not actual pain, I would say. But because your body does this, it actually makes all of your joints like different, and I've noticed like more swelling and definitely like just like feeling different in your hips and your legs, and that is not very fun. But again, the yoga and physio does help with that. I also learned that stretch marks are genetic, although I think I mentioned this the last episode, I do have stuff that I'm trying to use to prevent them. And something that's reassuring is a lot of people say that your nipples and your boobs do go back to normal, your nipples at the very least. So let's hope that that's true. But one last thing that I learned that I didn't realize, not that I didn't realize, I was just confused by it, is the comparisons to fruit. How can a baby be a banana one week and like a pomegranate the week before? It makes no sense. So I was looking into it, and what it actually is more so the length of your baby from either head to bum or head to toe. And depending on the fruit or vegetable or whatever it is that they're comparing it to, they might only be talking about the length from head to toe, not necessarily the shape of the baby or the size of the overall baby. But I was really confused by that because at first, when they're talking about the sizes, they'll say like baby's as big as a grape or an apple or an orange. And then they just start saying like as big as asparagus. And like to picture a baby in those shapes is weird. But it's because for the first trimester, maybe some of the second trimester, they go by measuring head to bum. And then at a certain point, they kind of switch and they go head to toe. And then sometimes they still do measure head to bum. Like in my app, it still does that. So that's why it can be a little bit different if you didn't know, if that was confusing to you as well. And one last thing I wanted to talk about was my mindset when it comes to clothing. I don't want to buy a bunch of maternity clothes. It's hard to find maternity clothes. What makes sense to me is wearing things that I already had that just might fit a little bit better or might be a little bit looser. I did buy a couple things that are more bump friendly, but I didn't want to buy a ton of pants or like coats or anything like that because I am going to be at my biggest in the summer, thank God. But I also don't care about like showing my belly or anything like that. I'm only going to look like this for another 3 months, so I'm going to milk it. And if I'm feeling good and comfortable, I don't really care if my belly's out. But you see comments on social media where people are telling women that they should cover up when they're pregnant, and I just don't subscribe to that. No one's ever had a problem with me having my boobs or my belly out before, so I actually have a reason to have it out now, and everyone should be okay with that. And the body changes, like, I haven't gone through too much. It is still hard at times. For me personally, I think I fear postpartum more. I feel like I'm probably going to struggle with that. But currently, I don't really have too many issues with my body changing. I am fearful for the third trimester because I know that I'm just going to get so much bigger. And it's more so like having it be uncomfortable to sleep or hard to move around. Like that is really taxing because you just don't get a break from it. But again, like everyone is different. I've heard people make comments before about people who may not have gained a lot of weight during pregnancy, talking about how it's really hard for them. And some people make negative comments like, oh, they have nothing to care about, or like so and so might have had it worse. And to that, I say any bodily change can be a mindfuck for some people, especially if you've had any like disordered eating or body dysmorphia or whatever. I feel like it's probably more difficult. Like, I've had episodes before where I've said, like, I don't think I ever had any eating disorder, but I definitely have had disordered eating, if that makes sense. I think most women have in one way or another. And it's really weird to, like, try and shrink yourself and try and stay fit for so long. And then this happens and, like, you have no choice but to grow. But again, like, everyone feels differently about it and everyone has a right to feel how they feel about it. And I think we need to stop telling pregnant people how they should feel, like, oh, you're not that big, or you're super big, or whatever. Like, it's crazy the amount of comments that we all get on our bodies when we're pregnant. And that's been one of the more frustrating things to me. I asked people on my social media, like, what are things that really irritated you to hear when you were pregnant? And there were a few things, but most of them were like, when people ask if you're having twins because you're so big. When people say, look at the size of you. or just like any comment. Like some people have said, so and so is just as far along as you and you're way bigger, or things like that. Like that's just insane to me to say, especially to a woman who is already uncomfortable, pissed off, and irritable. It's kind of crazy. And I think it's a generational thing. Like most people who responded to me said that it was more so the boomer generation who made comments like that. And people have definitely asked me if I'm having twins, but like my belly is very on par with other women who are 6 months pregnant. Um, so like it's just a weird comment to make because it's not a positive comment. It's not even really a negative comment, and I don't think people mean it badly, but I think we all just need to stop commenting on pregnant women's bodies and just say, you look great. And if you don't want to say that, then just ask how they're feeling. Like, I'm fine with that. Something someone else said is when people just give you like unfiltered or unprompted, I guess, traumatic stories. I think there's a difference between saying, like, oh, I had a really interesting experience with an epidural if you want to hear about it, or just saying, like, don't ever get an epidural. This is what happened to me. And I think people tend to be very like, do this, don't do this. You don't get an award for doing this or doing that. And I know a lot of the times people are just trying to comfort you in a way of like, do whatever you want because you don't get a medal for getting an epidural or not getting one or whatever. But at the same time, you're putting a negative spin on the thing you're telling them not to do, if that makes sense. And I think it's a totally different thing to say, I found this aspect of postpartum hard, or I found this aspect of having a baby hard, and like sharing your own experience rather than being like, just wait, this is going to be so hard for you, or whatever. Because like all babies are different and all people are different. And what works for one person might not work for another. But all the comments that we get, even like from all ages, I find that people are very quick to say what to do and what not to do. And there's so many different ways of doing things and being a parent and having a baby. So that's it for part one. I will do a part two on my second trimester recap. I know this was pretty much just a rant. And I'm like uncomfortable and sweating and actually feeling kind of emotional at the moment. So that's just like an accurate portrayal of what it currently is. Like, I'm so happy, I'm so excited, I'm so grateful. But at the same time, like, all of the physical ailments are really, really frustrating. And I just want a break. But it's fine. And like compared to how I was in the first trimester, I know that I'm much, much better. And the timing actually works out really well. Like I've had a few friends be like, oh, it sucks that you're like trying to move and finish the house at this point. But I actually have more energy than I had in the first trimester. I'm not too big yet. Like I'm still moving around pretty comfortably. Even though I am getting more uncomfortable, like I can still do things and I can still be on my feet, and that's not an issue at all. And I'm going to Dublin next week for a friend's bachelorette, so I think that will be very well needed. And it's going to be, even though it's a bachelorette, it's going to be very relaxing. And we have like a spa day and like a sightseeing day, and we can sleep in. And I'm so excited. And I think having all the stuff done with the house before I go and kind of finishing up when I get back as I'm starting the third trimester, I think that's going to be very good because I can just park myself for the summer then and just rest and grow and walk and just prepare for baby without any other stressors. I think I would rather the timeline that I've had where like I was really sick in January, February when not much is going on. I was second trimester up until now, like the end of May, and I was able to get some stuff done. And then I can just actually enjoy the third trimester. So I'm excited about that. And I think everything will calm down a little bit. But overall, I'm happy with my timeline. I also think it'll be good to give birth in August while it's still nice out and I can still get out for walks and stuff. But then I can just bundle up all winter and I don't need to worry about like being in a swimsuit or anything for a year. The thought of that does does give me some peace. So that's where I'm currently at. Very excited. But it's a roller coaster. Every trimester is different. Every week is different. I find when one symptom goes away, another one starts. So yeah, it's all a learning experience. But I think if nothing else, the main takeaway from this episode is just understand that everyone has different opinions and different feelings about pregnancy, and everyone handles it differently. And there are so many ways to cope and to enjoy it. And we don't have to lock ourselves in our houses just because we're pregnant. There are still a lot of there's still a lot of people who judge, and I guess that's always going to be there. But I think the more people that kind of share their truth and like their normal day to day, I think that will just normalize all of the things that are so common. Stick around for next time. I'm going to talk about all the appointments I had in the second trimester and how they all went, and any like tips and tricks for those. And then also, I did ask people as well on my social media things that you were worried about that were actually fine, or things that you were worried about that you were right to worry about. So we'll see what people say about that. And you can find me on all social media at Newfound Happy Hour. All my episodes are on YouTube, and everything in this season, this is the 5th year I'm doing this, so season 5, that's all on video on YouTube. Some of season 4 is also on video, and every episode is just up on YouTube. So that's the easiest place to find it all. And I will see you next time.